I used to be very disenchanted seeing patients in the office because I didn't see them improving at all. I didn't see their blood pressures improving. I saw them becoming more obese, more diabetic. And even though their LDL would drop, I could never correlate that LDL with any improved outcome in my patients. So I belonged to a racing team. And even though I was never particularly heavy, I was up to about 175 pounds despite cycling about 1,000 miles a month. And I couldn't explain why am I getting heavy? And so one day I was listening to this podcast and some information that Chris Froome, who was doing very good in cycling at that time, he's a Tour de France cyclist, that he was a low carb athlete, improved his power to weight ratio, which means that the amount of power he can put for his own weight was quite high, and it improved with a low carb diet. So I said, let me try this. And within a few months, I was down to 160 pounds. But since then, I've come down to 145 with further fine tuning as I learn more. But I said, if this is so easy in me, why am I not trying it in my patients? And so I've pulled myself away from the cath lab. I've hired a couple of colleagues who do my procedures. And I spend the bulk of my time counseling patients. And it's a learning experience. I learn every day. When a patient listens to my advice and he loses weight, his blood pressure gets better, his sugars get better, he comes off diabetic medications, he comes off blood pressure medications, he feels better. That is such a strong validation for him. That he goes and tells many of his colleagues saying that, hey, there is this doctor who's doing something different. So being relevant, being somebody who can actually improve somebody's health.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.